GEMIS Hospital Information System solves your business task successfully. GEMIS Medical AG, a software plant located in Germany, has an experienced international team of analysts, designers, developers, and IT professionals to create and implement health information systems. More than 20 years experience and close development with physicians as well as medical institutes are base and warranty of our high-quality products. GEMIS HIS, a single source and product for integrated automation of your clinic. Each employee is involved in the business process that contributes to the common task, the fast delivery of quality healthcare to the patient. So get acquainted with. In practice, the system helps to optimize the performance of medical organization. The patient calls the clinic. Performing the initial registration of search for existing records in the database and make an appointment with a physician. We selected a doctor on the monitor in the task list. Instantly, it adds a new record. Patient at the doctor. Doctor quickly describes the state of the patient, generates documents of initial medical examination by using the templates system. For the comfort and speed of fill-out, field guides and transfers are used. At that time, the patient is assigned for an additional examination by other specialists, who are automatically generated lists of their tasks. Task list always before the face of all system users. This is an accurate plan for the organization of physician and a complete control over the use of resources in the clinic. The patient at the lab. The analytical results shall be recorded in the survey. The physicians conclude the lab. The status of the current task in the system changes, and the information picture of the patient is replenished with new data. Radiological examination. The task can be formulated as medical diagnostic and diagnostic equipment. For example, assigning the patient radiological examination, the system automatically created a record in worklist about a specific device. After saving the results of studies in the database, the system changes the status of the task on executed. The patient returned to the doctor. Record readmissions already has him in the task list, available for viewing data of laboratory and radiological investigations. Picture of clinical examinations was formed. Hospital. The doctor's route is based on his task list records. After receiving the electronic card of a new patient and his examination, the doctor makes a number of appointments like treatments, diets, procedures and medications. The information about the appointments is automatically distributed to the respective specialists via the system. Mode of medication is automatically displayed to the nurse by a list of her tasks. Pharmacy. Logical connection within the system allows physicians to prescribe medication from their desk and forward the prescription to the pharmacy. Naturally, it determines dosage, indication, and duration of prescription drug use. Prescriptions can be forwarded to the pharmacy only if the treating doctor has given an electronic signature and has been identified by the system. Observation results of the patient will be recorded by the attending physician into the diary entries. If a case requires further consultation, there is the possibility of telemedicine. The doctor sends an electronic request to a remote consultant and has attached all necessary data of the electronic report before. Information which pass the telemedical communication channels are securely protected in use of advanced encryption algorithms. In case of a patient's operation, the system can run exactly for the required time limit of preparation, include into the operation block, and assign appropriate operation team. All prescriptions are displayed in the system and controlled by the administration of the hospital. Extract. patient's discharge is accompanied through issuing a discharge letter. The EPIC crisis is generated automatically on base of the patient's electronic record. The system automatically takes into account all the costs of patient's treatment and generates the required document for financial managers. All movements of the patient are recorded in a separate documents system. Management of clinic or hospital will have full control. Accounting of all resources will be provided by reports of information, etc. JAMIS system is a real basis for the creation of a unified information system in healthcare.